So the genetic testing results are usually straightforward, but not always. And I think that highlights the importance of genetic counselors and having genetic counselors involved, because you can get a normal genetic test, a negative genetic test. You can get an abnormal result where they find a gene mutation, or you can get something inconclusive. So it can be really helpful to have a genetic counselor involved to help interpret those results for patients. If a patient is found to have a gene mutation or a clear abnormality in a breast cancer gene, that doesn't mean that they will for sure develop breast cancer. It does, however, increase the risk. And in certain cases, the increased risk can be quite significant. In general, the average woman's risk to develop breast cancer at some point in her life is about 12%. And if someone has a BRCA1 gene mutation, for example, her risk might be up to 80% in her lifetime. So it's a very significant increase, but it certainly is not 100%. There's a misconception a lot of times that people feel like the genetic testing is some sort of crystal ball and it's going to tell them exactly what's going to happen, and it really can't do that. What it can do, though, is help a person understand in what risk category they might fall. So we try to put people in categories of risk. Are you average risk? Are you sort of medium increased risk? Or are you high risk? And so someone that has a gene mutation would fall in that high risk category. And what that means is, you know, unfortunately they're born with this genetic predisposition that makes them much more likely to develop cancer, breast cancer, and sometimes other cancers. Patients who have genetic testing who are found to have a gene mutation are offered a lot of different options and choices. Some of them choose to do a more preventative route where they will do preventative surgery and have breast tissue removed in a way to prevent cancer from developing. Other patients will choose more of a detection route where they don't want to do any preventative surgery. They'll just do a lot more screening with mammogram and breast MRI and hope that if a cancer develops that they'll find it at an early stage. So part of our job is just to figure out you know, what's right for that particular patient at that particular time. Some patients will see us and will not be recommended to have any genetic testing. Some patients will have genetic testing and it will be normal. And unfortunately, there's a misconception that if you're tested for the breast cancer genes and it's normal, you're protected against developing breast cancer, and that is not the case. Every woman has a risk of developing breast cancer. 1 out of 8 women will develop breast cancer at some point during their lives. So again, the genetic testing is just a tool in that risk assessment. You can still have negative genetic testing and be at risk to develop breast cancer simply because it's in your family. So genetic counselors help to interpret the negative results for patients and talk about their family history, and based on that family history, make recommendations for what people can do. For example, what age should they start mammograms? Should they do something besides a mammogram, like a breast MRI? Are they a candidate to take a medication like tamoxifen that would decrease their breast cancer risk? Some of the misconceptions that patients have about genetic counseling include insurance issues, and I guess also just the counseling process in general. Patients are often afraid that their insurance is not going to cover any of the genetic counseling or genetic testing costs, and it can be quite costly. But the good news is that almost all insurances will cover genetic counseling. Genetic counseling is usually just a regular office visit fee. Genetic tests can be expensive. They can be thousands of dollars sometimes. But most insurance companies, if not all insurance companies, will have criteria on who they will cover for genetic testing. And if you meet your insurance company's criteria, then you'll often have very good coverage for genetic testing. Insurance companies realize, I think, that the genetic testing is truly preventative, and if they can pay several $1,000s for a genetic test for a patient, financially that's going to be a lot less expensive than having to pay for a cancer treatment, you know, down the road. So there is really good coverage for that. Some patients worry that an insurance company is going to use the genetic testing information against them. So if the patient is found to be at increased risk for cancer, there is a law that protects them. Their insurance company cannot drop them from their health insurance or charge them more for their health insurance. That is a big barrier for patients, and a lot of times they don't know that that law exists, so it's good to talk to them about that. And then just in general, some patients really fear coming in for counseling, and they worry that it's going to be a lot more psychological or psychiatric counseling. And so sometimes I wish that that phrase was a little bit different, genetic counseling, because it really is a sharing of information and empowering the patient to make good choices for them and the choices that are right for them.
Remember, be your own advocate. Create a proactive plan and empower yourself with knowledge. We don't want you to be another statistic. Thanks for watching this month's video blog. We'll see you next month.